Good morning and afternoon. This is Jen at AAPCHO. I'm here with Alan, and just want to thank you all for joining us for today's webinar in partnership with Nonprofit Vote. And our topic today is building a civic engagement list, excuse me, voter registration, and a second ask. Just a couple of housekeeping items before we get started. So just note that you all as attendees are currently in listen-only mode and that you'll be muted during the presentation today, but to participate, you're more than welcome to submit questions at any time during the questions field that's on your control panel. And we'll be reviewing the questions as they come in just to make sure that Lindsay has a chance to answer everything. And then also have an open Q&A session at the end of the presentation where you'll be unmuted and free to ask questions directly as well. Today's webinar is being recorded, and everyone will receive an email with a link to view the recording of today's presentation following the webinar. So in case there's anyone at your center who that couldn't make it today, we'll make sure they have a chance to see it. So I just wanted to, as we get started, just do a quick intro and talk a little bit about list building as it fits into the AAPCHO Civic Engagement Initiative. One of the things we wanted to clarify as we've learned as we've gone along is that there's been a little bit of confusion about what the list building activity is related to the project, and so we're hoping after today's training folks are a lot more clear and that you feel you have a good next step start on some tools that you can use if you don't already have a tool, or clarifications you may need to make in your existing tool. So basically, what is the list? What are we talking about when we talk about list development? Essentially, for our initiative, it's really a mechanism or a tool for the community health centers to contact and engage community members in issues impacting the overall health of their community. So this is more of a database from which you will be able to engage your constituents at the health center, whether they're patients or community members. And why this is important to our work as part of the Culture Civic Engagement Initiative is that the lists really are providing this grassroots base or a mechanism for all of our health centers to increase our capacity to mobilize our constituents, eventually, ultimately, as we saw with the funding cliff example, to impact local, state, and national policy. And also, I think I've spoken to many of you about the list building really being a little bit more of an accurate reflection of all the touches and work that you all are doing out in the field. So it's an additional measure of the civic engagement activities that you're doing just beyond just voter registration numbers. So we feel like this is a huge opportunity to kind of show more of that grassroots base and that greater reach that you all are making. As many of you have shared, you know, you may go out to events, and given eligibility of folks to register to vote, you may register, 10 people, but you've talked to 100. And so we want to capture that 100 because all those conversations really matter in this project. So that's just a little bit of context for why the list building piece is so critical. And I'm really thankful today to have Lindsay Hodell join us from Nonprofit Vote. And she's going to go through quite a bit of content today and some sample tools that we hope will be really useful for you all. So just a little background on Lindsay. I learned some new things. Lindsay is the National Field Director for Nonprofit Vote, and many of you had a chance to meet Lindsay in May. She brings more than a decade of experience in public policy, advocacy, community organizing, and nonprofit civic engagement efforts in the West and nationally. Prior to her current role at Nonprofit Vote, Lindsay founded the Colorado Participation Project, roundtable of direct service nonprofits that participate in client engagement programs. She now brings all of this experience at the state level to Nonprofit Vote, where she's currently directing the organization's state's program. So Lindsay has previously worked as a community organizer with Colorado Progressive Coalition, the PICO National Network, and the Sierra Club, and is a graduate of the Green Corp School of Environmental Leadership. She also has a degree from the University of Kansas and is currently pursuing her master's in divinity at Lift School of Theology. So with that, we just want to welcome Lindsay today, and what we're going to do, Lindsay, is pass you over the master control of the slides, so you can go ahead and proceed through those yourself. And it's all yours.
Well, thanks. Thank you. So can you hear me okay, Jen?
We can hear you.
Okay, wonderful. Well, thank you so much for that warm introduction, and thank you so much to Jen as well as Alan for your hard work coordinating today's webinar and for allowing me a little bit of time to present. It's great to be with you all, and I look forward to meeting any of you that I haven't had a chance to meet back in March or in May in DC, hopefully at your health center or agency coming up very soon. So again, thanks for having me. What I was asked to talk about is building our civic engagement lists, and in particular focusing on two pieces of our list building activities for this year. The first being voter registration, and the second being what we're calling the second ask. And there's a couple different options that many of you have already begun to implement for your second ask, and I realize for some of you on the call today, this may be a newer element to the civic engagement program and your work that's happening, and so definitely feel free to ask questions, don't be shy, and look forward to hearing how things are going if anybody is also willing to share that. So let's dive right in, first of all, on why list building is important and how we are using this as a strategy. And let me just advance our slides. Wonderful. So I should just note, for those of you who aren't familiar with Nonprofit Vote, we were founded in 2005, and we partner with America's nonprofits to help the people they serve participate and vote. We're also one of the Coulter consultants on their civic engagement program, and so we'll be working with Coulter and AAPCHO over the next 3 years on this exciting program. Whoops. Alan, I'm having a little trouble with the slides. Would it be okay, Alan or Jen, if I have you advance the slides for me? Because my arrows are not popping up. I apologize.
No worries. We got you.
Thanks. So if we could go back to a couple of previous slides, why list building? I'm not sure why these arrows disappeared. Sorry about that. A couple more back.
There's a little delay, Lindsay, so we're just waiting.
Okay. We are all seeing a sneak peek of what I'll be talking about. All right, perfect. So why list building? And Jen articulated many of these points very well, so I won't repeat anything she said, but just to put a little bit of a finer point on why list building is an important part of any civic engagement strategy. First of all, this is a list of individuals that we are keeping contact information for so that we can engage them in many ways, through voter registration, through voting, and in many other ways as health centers. So this is really, list building is an opportunity to really build, I hate to use military analogies, but really an army of volunteers and advocates that we can engage in many ways to support our health centers. So we can engage this list of individuals in voter registration and voting, on policies and on issues, and then also for general health center programs. This would be a list in particular that you might consider reaching out to for things like volunteer opportunities for the health center in general, or for your health center in general. So list building is a way to really capture, again, the contact information and the interest of individuals who may be interested in doing more with you. And this is really a list that you can claim and own. These, I like to think about our civic engagement lists as our, again, our army of advocates, or really our potential volunteers and our people. So this is a list that you can hopefully be proud of and really claim as your own. I mentioned that list building also helps us identify, oops, sorry about that, if I can go back to list building. Great, thanks so much. This is also mechanically, or just from a logistical standpoint, civic list building is a way that we can keep a distinct list of individuals and their contact information separate from our client databases and separate from client information. So of course, this is very important for us to remain compliant to HIPAA and other federal regulations around client information and patient privacy. And list building, civic list building, is a way, again, that we can ensure that we are remaining compliant to HIPAA, but then also keeping contact information separate from the client contact information that we're not allowed to use for voter registration, voter engagement, or other issue advocacy. And lastly, why list building in 2015? So this is a way for us to really begin to build for 2016 as well. So these are individuals that are, in many cases, visiting our health centers more than once throughout the year, and hopefully will be continuing to visit our health centers in 2016. These are also individuals that live in households and have friends and family members. And so as we begin to think about engaging the individuals on our list as future advocates, definitely we can see opportunities for helping them engage others and helping us expand our reach even more heading into 2016 and beyond. So just a few ideas of why list building is important, and if we can go to the next slide, that'd be great. So the first thing that I was hoping to talk about is, of course, voter registration. And voter registration is of course, a strategy and a tactic that most of us have already begun to implement within our health centers, or will be very soon. So what I was hoping to focus on for voter registration is just offering a few practical tips and practical strategies for fitting voter registration into ongoing programs and ongoing conversations that you're already having with patients, constituents, and other community members. So first of all, what we know in terms of voter registration from an emerging body of research that is pretty compelling is that the best conversations to integrate voter registration into are one-on-one, face-to-face conversations. That is not to say that more broad emails or announcement at classes or announcements at jobs trainings, opportunities, or making more broad announcements. It's not to say that those don't make sense, but what we see in terms of effectively registering individuals and making sure that we register them accurately and effectively and successfully, that again, one-on-one, face-to-face conversations are the best venues to integrate a conversation about voting. So I hope that this is helpful in helping you think through strategies and tactics that may make sense for your health center in how your patient flow works and how you already interact with patients and community members. And of course, not all conversations may make sense, but many of them, especially one-on-one, face-to-face conversations, definitely do. So a couple suggested strategies that we know have worked specifically for health centers and for health center staff include, first of all, setting up a table in the waiting room or lobby. And many of our friends in Lowell, Massachusetts are having great success with setting up tabling activities during high traffic times in the waiting room, in the lobby, and also at community events as well. So that's definitely an effective strategy, whether you are staffing the table with permanent health center staff, or whether you may be utilizing volunteers or even an outside organization, tabling in the waiting room or lobby is definitely an effective strategy for voter registration. We do recommend considering high traffic times, and we also recommend that it may not make sense to have a table set up in the waiting room or lobby that's staffed at all hours of the day. You definitely want to try to find those sweet spots and those high traffic times so that the volunteers or staff members have enough people to effectively talk to and engage. The second strategy that we know works is doing canvassing, quote unquote, at events, festivals, and fairs. And in particular, I've had the pleasure of working with members of many outreach teams across the health centers that we've worked with, and outreach teams have done a great job of integrating voter registration into their work at events, festivals, fairs, and other community gatherings. And so what we recommend for this is to staff as many people as you can, depending on the size of the event, with voter registration forms and a clipboard, as well as information about voting. And rather than setting up a table or sitting behind a table and waiting for people to approach you, walking around those events or those festivals, approaching people with an ask to register to vote. And again, these canvassing activities have definitely been successful for many health centers and also help to achieve some good numbers and some good scale because you have a lot of people you're talking to all at once. And recommend is integration into community outreach activities. And so I've already talked a little bit about this with high traffic neighborhood spots, also at local pharmacies and local restaurants. You know better than anybody what the most effective outreach strategies are for engaging communities and in engaging potential new patients. And these are really great opportunities to also have a conversation about voting and to make a voter registration ask. The last point I will say about this is that oftentimes our outreach teams are already very used to approaching strangers and asking them to do something, and are very often very comfortable with those kind of cold, quote unquote, conversations. And so oftentimes outreach teams are very effective for voter registration because of the similar nature of the conversation. And then the last strategy, and I know many of you have piloted or experimented with this already this year, is in integrating voter registration into enrollment, into health insurance, Medicaid, and WIC. And we know that there were some challenges initially with integrating voter registration into the initial enrollment period because appointments were taking a long time, and sometimes we weren't always able to provide the kind of insurance that people wanted or needed. And so as healthcare reform and insurance marketplaces have been around a little bit more, and now we're going through re-enrollment and kind of doing this for not the first time, we're definitely seeing more success with integrating voter registration into re-enrollment, health insurance renewals, and also enrollment into Medicaid and WIC. And so we definitely recommend this as an ongoing strategy. It's something that you can do year-round, whether an election is approaching or not. But we also know that integration for voter registration into these kind of enrollment activities don't yield as high of numbers as some of the other strategies. So when you're thinking about voter registration work as a whole, we always recommend looking at multiple approaches. And the enrollment integration is so important to continue to foster. And we know that focusing on some of these other complementary strategies will definitely be important for us reaching our number goals. So let's go to the next slide. So a couple just practical tips for voter registration. First of all, if you are going to set up a table in a lobby or a waiting room or during a high traffic time at your health center, it's really important to remember to use strategies for what we call active tabling. And I'll point you to a resource that we have at Nonprofit Vote on our website. You can download this, and we can also email it after the webinar, that includes a few quick pointers for doing effective active tabling. So a couple key points to keep in mind if you are doing any kind of tabling, again, at your health center or even out in the community, is that it's important to make sure that we are approachable and that we're enticing people to come up to the table. Simply assuming that people are going to rush over to your table and register to vote is probably an incorrect assumption, unfortunately, and we really do need to have our tables be inviting and use strategies that will entice people to approach us. So this can include standing up and greeting people. I usually give a quick wave when people walk in, if that's comfortable to you. And also decorating your table with bunting, with tablecloths, signage, and other freebies. We often include candy or other healthy snacks to entice people to come up to the table and ask us what we're doing. I mentioned finding the highest traffic times within your health center. Usually it's not effective to do tabling at all hours of the day, in particular slower traffic times. So working with front desk or administrative staff to really find those sweet spots and those highest traffic times is important before starting any kind of tabling program. And then lastly, working with staff to send patients to the table is also an important strategy to consider. So even if somebody is staffing the table, whether that be a volunteer or a permanent health center staff member, having your front desk staff send people over to the table, or even having physicians say, did you stop by the voter registration table? We're doing voter registration, it's really important, can really boost the amount of traffic and the amount of people who come up to the table and with whom you will have an opportunity to have a conversation with. One community health center in Colorado even has physicians write prescriptions for registering to vote. They were not real prescription pads. We designed them with civic engagement and voter engagement materials, but the physicians themselves were writing prescriptions for patients who were not registered to vote to visit the voter registration table and make sure that they update their voter registration information. So one creative strategy for working with other staff members to send patients and community members your way. Let's go to the next slide. Another opportunity this year, that's a new program that we at Nonprofit Voter are helping to launch, is an effort that is focused on making sure that the staff and volunteers of our nonprofit partners are registered to vote and are voting. So the Nonprofit Vote Count is, again, a new campaign that we are piloting this year and that we've launched in partnership with the National Council of Nonprofits, the United Way, and the independent sector to, again, bring a focus on ensuring that nonprofits staff and nonprofits volunteers are registered to vote and are voting, because we know democracy begins at home, and we also know that it's sometimes difficult to ask somebody to do something that we haven't done ourselves. So again, the Nonprofits Vote Count is a national campaign to register all eligible nonprofit staff and volunteers to vote and to help them vote with resources and tools designed to make it easy to do so. So as a first step, as part of Nonprofits Vote Count for 2015, we recommend using the week before National Voter Registration Day as a way to bring a concerted voter registration effort to your staff and volunteers. National Voter Registration Day is an annual holiday for democracy that is endorsed by the National Association of Secretaries of State and receives really exciting media coverage every year. And this year, National Voter Registration Day is on Tuesday, September 2nd. So again, we recommend as a first step using the week before, September 22nd, as a way to bring a focus and a concerted effort to ensuring that your health center staff and your health center volunteers are registered to vote and are equipped to vote on Election Day. So if we can go to the next slide, please. And again, a first next step on Nonprofits Vote Count is getting signed up to receive those tools and resources that I mentioned. So you can visit and get started with Nonprofits Vote Count at nonprofitvotescount.org. The URL is right there on your screen. And this is a screenshot of the sign-up page. We're asking that nonprofits do go ahead and sign up so that we can really demonstrate our national reach with this program and as a nonprofit community. And then also this is the way that we'll know to send you resources and a toolkit that includes buttons, posters, training materials, and other resources for implementing a Nonprofits Vote Count campaign at your health center. Next slide, please. So now that I've talked a little bit about voter registration, let's move to what we're calling the second ask. And of course, we know that there's a few limitations to only focusing on voter registration. And so that's why thinking through what kind of second asks make sense for your health center is so important. And just to elaborate a little bit more on why a second ask is critical, first of all, this is one measure of evaluation for this program. So Coulter, AAPCHO, and all of us will be looking at one way to measure our success as the number of individuals who have joined our list. And the number of individuals that we've been able to sign up for our Civic list. And by incorporating a second ask, we are ensuring that we can sign up more people onto the list and we can demonstrate a bigger reach. We also need more ways to sign up patients for our Civic engagement list who are either already registered or who are not eligible to register to vote. So, of course, for people who are already registered and whose registration is up to date, that's really great. And we still want to engage those patients and those community members in other ways. And so one way to engage people who are already registered is to, again, think through what other kinds of engagement asks, what other kinds of tools can we utilize to sign this person up for a list, a Civic list to do something more in the future. The second piece, why the second ask is important, is that many of our patients and community members may not be eligible to register to vote. They may not be U.S. citizens, they may not be U.S. citizens yet, or they might be under 18. And so we still want ways to engage a very diverse population and individuals for whom voter registration is not quite the first next step, or who are not eligible to register to vote. And so there's really three options for these second asks, or for the second ask, that have emerged through our work at Nonprofit Vote and then also from the work that many of you are already implementing. And those three options include a pledge to vote card, a more general civic engagement card, or an advocacy card. The one thing that I would love to just mention very briefly is that these tools that I just mentioned, the three tools I just listed, these are all physical cards. And so these are postcard size or even full page cards that we can help you design and get printed that you can use and actually hand over to a patient or community member and have them sign up, just like you would a voter registration form or voter registration card. So if we could go to the next slide, I'm going to go through these three options a little bit more in detail. The first option that may make sense, and in particular, if you have a fall election coming up in 2015 in November, a pledge to vote card is a great second ask to consider. A pledge to vote card is essentially asking a patient or a community member to promise to vote and to commit to voting. And we know from a social psychology standpoint that if somebody promises that they're going to do something to another human, they're more likely to do it. So one of the great benefits of using a pledge to vote card is that we know it inherently increases turnout. If somebody commits to you and signs a pledge to vote card to vote on election day, they are more likely to do that action and to actually turn out and vote. So it's a great way to boost turnout. Another benefit of the Pledge to Vote card is that it often includes election information. So you can see a sample on your screen of a Pledge to Vote card that we're using for this fall election with one of our state partners, MassVote. And you can see that it also has information about the election. There's a number both in English and Spanish that you can call if you have questions about voting. And I know that there are efforts to expand languages that are available through those hotlines. And then also information for MassVote themselves, so that if a community member, an individual, has any questions for MassVote or has any questions about voting, there are several ways for that person to find out more information. I also really like the Pledge to Vote cards because we're able to include polling information. So you can see right here that polls are open in Massachusetts from 7 a.m. to 8 p.m. And so it's a way to also educate people about the voting process in a very proactive way. The Pledge to Vote cards that we've designed have a tear-off, so the person can also take some information with them. They basically fill out the bottom portion of this pledge card. The person talking to that individual then takes that with them, again, so that we can keep them and add them to our civic engagement list. And then the voter can take the top portion home with all of the relevant information they need. And I'll go through a little bit, because it's a little bit difficult to see on your screen, the fields that we recommend including on any of these second ask cards. So if we can go to the next slide. So if you don't have an upcoming election this fall, it's a little bit challenging to ask people to commit to voting on something, in a way where they may not have that opportunity. So for health centers who may not be doing work around an upcoming election or might not have an upcoming election in 2015, we'd recommend considering a more general civic engagement card. And this is a civic engagement card sample from Waianae Coast Comprehensive Health Center in Hawaii. And I apologize, it's a little bit blurry here, but we can definitely send out this template after the webinar. And as you can see, this is a civic engagement card that essentially gathers the contact information and a little bit more information about the person that you're talking to. So this civic engagement card has a sample for allowing the person to say they're a registered voter, or if they would like assistance, either registering to vote or registering to vote by mail or through an absentee ballot. The civic engagement card also asks for the name, phone number, email, and address of the individual, and also has a both email and a phone number for Myrna, who can accept any questions and who can be contacted if the person has questions or wants more information. So again, a more general civic engagement card might be a helpful strategy if you don't have an election coming up this fall. If we can go to the next slide, please. The last option for a second ask may be that you can consider may be either an advocacy or an issue card. And many of us are familiar with the advocacy card on your screen. This was a postcard or a one-pager that we used around the fiscal cliff issues earlier in the year. And I know that many health centers had great success using and collecting this issue card or this advocacy card. Now that we have at least a temporary resolution on this issue, I know many of us are thinking about either local, state, or federal issues that may make sense to also talk to our community members about. And this template is something that can be easily adapted to a different issue or a different advocacy campaign, but still includes the information that we need to collect for our civic engagement list. So again, if you have a local campaign or a state issue or something federally that you're interested in engaging people around and having a conversation about, an advocacy or an issue card is a great way to collect the contact information from those individuals so that you can still add them to your civic engagement list. So that's the third option I really wanted to highlight in terms of options for the second ask. We can go to the next slide. So the needed fields, whatever you choose to do, or whatever you choose to utilize as your second ask and as your second ask tool, the needed information in order to be able to contact this person after the fact, as well as do an effective what we call list match to the voter file, a public records database that we can use to analyze and assess whether people successfully registered and whether they voted, is the first and last name, your physical street address. For voter registration, it is required that you list a physical street address in addition to a mailing address, if you use a PO box or another mailing address, a phone number, an email address if they have one. Not everybody has an email, or not everybody checks their email, and also a language preference. And whenever possible, it's really helpful to collect language preferences, in particular within community health centers. We serve an incredibly diverse population, and when we follow up with people, we want to know which language they prefer for that follow-up. So these are the recommended fields that we suggest you include on your second ask tools, whether you go with a pledge to vote card, a civic engagement card, or an advocacy card. So next slide, please. The last tool that I wanted to highlight that is, again, we can send out after the webinar and is easily able to be downloaded on our website, is a sample script that you can use to guide your conversations with patients and community members, and that can also help to inform any trainings that you may offer to staff or volunteers. So we are happy to share this Making the Ask script, and as you'll see from your screenshot, the script really starts with our first ask of voter registration. After we talk about voter registration, this is a sample script that helps guide a conversation about pledging to vote and making a commitment to vote and using that pledge to vote card. But the tool and the script can easily be adapted to a civic engagement card or an advocacy card if those are the routes that you choose to go down. So again, I want to highlight this Making the Ask script and just a couple pieces of quick tips that are included in this. The first is that you can see on your screenshot the intro, and I wanted to point to a couple things in the intro and in beginning a conversation about voter registration. So as you can see in the intro, our script, or our suggested script, starts with informing community members that we're updating voter registration for the upcoming election. So we specifically included language and an ask around, can we help you update your voter registration information, and are you registered to vote at your current address? And that is because in our experience, sometimes asking people if they're registered to vote, just simply, are you registered to vote, may make the person feel embarrassed if they aren't registered to vote. We know that voter registration is one of those things that we should do. We're all told it's our civic duty, and we don't want to embarrass anyone if they happen to have not registered to vote, or if they've let their voter registration lapse. And so asking people to update their voter registration information allows them to say, yes, I need to update my information, and they don't have to then admit to somebody who might be a stranger that no, I haven't registered to vote, or I haven't taken the time to make sure I update my registration after I've moved. And so that is one piece of the script that I think for voter registration is important to mention. The second piece that I wanted to mention in our voter registration script is that we do what I like to call a little double confirmation with people around their mailing address and whether they've moved since the last election. So if you can see in the voter registration script this if yes prompt, so after we've asked if anyone needs to update, or if the person needs to update their voter registration information, and the person says yes, if the person says, I'm sorry, yes, I am registered to vote, so no, I don't need to update my information or re-register, I'm good. We say, great, have you moved since the last election? because oftentimes people say, oh, wow, yes, I have. I forgot about that. I've actually moved a couple times. I moved last fall. And so double confirming that the person is still registered to vote at their current address is an important strategy for capturing people who may have forgotten that they moved. So those are a couple of the practical tips I wanted to point out in our Making the App script. And again, we'll send out the script after the webinar, and we're always available for more questions as you're looking to adapt the script and implement it. So if we could go to the last slide. Just wanted to offer my contact information. I'm based in Denver, Colorado, and my colleagues at Nonprofit Vote are based in Boston. My email is included on this last slide, and our contact information, our phone number, is also listed at the top of your screen. We're at 617-357-VOTE. And so definitely wanted to leave my contact information with you all. Myself and our Nonprofit Vote team always appreciate getting calls and getting questions. And again, we're just really looking forward to continuing to work with you all over the next 3 years. And we're really thankful to AAPCHO for your great coordination and your leadership on this project. So again, wanted to offer my contact information, and I believe we have a few minutes now for a couple questions.
Lindsay, we had one, this is Jen, we had one question that came in as we were going through the cards. I think one of the questions was, what information, if an individual is homeless and they're filling out any of the card tools, what information at a minimum should they make sure to get from them, or strategies to work with them? Yeah,
that's a great question and a really important one. So I appreciate that question being asked. So for individuals who are experiencing homelessness, they can register to vote, and they can do so by either registering to vote with the address of a shelter that they call home, a local church that may offer their mailing address for homeless individuals. And if all else fails, a homeless individual can also actually register to vote using a street address or a physical location in the community that, again, they call home. So if somebody lives at on a particular intersection or near a particular bridge, they can register to vote using those physical addresses. For a few of our states, we have vote by mail systems. And so for individuals receiving a ballot through the mail, I definitely recommend considering either using a homeless shelter or a local church as their address, so that they can appropriately and effectively receive mail and vote that way. But the other options that I mentioned are also open to them and are federally protected by law.
Great. So next question, Lindsay, was it's a general question. So are the health centers allowed to give out incentives to register people to vote?
That's a great question. So yes, the short answer is yes. Health centers can absolutely offer incentives to register to vote. What we recommend is that those incentives do not have any cost value, or if they have any cost value, it is extremely low. So offering things like gift cards or anything with a monetary value can get a little uncomfortable. And any kind of naysayers or individuals who may be uncomfortable with voter registrations happening in our health centers could really, that could open us up for attacks and could be seen as trying to bribe people or inappropriately incentivizing people to register to vote. And so again, things like candy or a button or a free sticker, things with low monetary value are good strategies, especially if you're doing tabling, and are good strategies for incentivizing people, again, as long as they have either no cost value or very low cost value.
Great. So another question, are clients and community members more responsive to signing the pledge card versus the advocacy card or issue card or civic engagement card? I guess in your experience, are people more receptive to one over the other?
No, not necessarily. I think that the context is the important consideration for choosing your second ask tool. And again, if you have an upcoming election, pledge to vote cards are incredibly effective and are also are great for achieving numbers. We've had a lot of success with pledge to vote cards, but again, really it's mostly just if you have an election coming up. It's hard to ask somebody to commit to voting in November of 2016. After all, that's more than a year away. And so if you don't have an election and the civic engagement more general card makes sense, we've had just as much success with those civic engagement cards as long as the staff and the volunteers who are asking are doing it in an effective way and an assertive way. And then lastly, the context to consider for any issue or advocacy card is, of course, what has your health center taken on in terms of issues or a policy agenda, and if there are issues that you want to do additional advocacy around.
Great, thanks, Lindsay. One thing I wanted to note, this is Jen at AAPCHO, was I think maybe several of you were able to attend last week's webinar, which went through a little bit more about HIPAA compliance and the civic engagement programs at the centers. But with regards to the cards, I think I just wanted to also emphasize, it was made clear on that webinar that there, and as Lindsay went over, there is no need for you on any of these cards to have your health center name or anything like that as an identifying field, nor a question on your card that asks whether or not that community member or individual uses the services at your health center. So I just wanted to make that very clear that those two questions are not to be included in these card tools. So I hope that's clear, and if you have any questions, feel free to contact me. We can talk more, and we are also going to be sharing the link to that webinar as well. We're still awaiting that information, but that was helpful to know because I know we needed to update a few folks to remove those fields from their cards. So you just basically, as Lindsay stated, this is a separate list from any of your client data that you have, so no need to draw that parallel between this tool and your client experience list. Cool. Is there any other questions folks can, you're welcome to put them in the chat box. I think one additional question that I had asked Lindsay that I thought might be good to share with folks is, because we know several of you have a local municipal election in 2015, was how soon you should, when's the best time to introduce a pledge card tool? I don't know, Lindsay, if you want to share your experience with that.
Of course. Essentially, of course, the answer is as soon as possible, as it usually is. But in all seriousness, we really find that the general public, the most amount of interest around an election tends to happen in the 6 to 8 weeks prior to any given election. Of course, many of us are thinking about elections much more in advance of that, even years in advance. But in terms of the general public, interest and awareness of an upcoming election usually peaks in the 6 to 8 weeks right before Election Day. So it's important to think backwards in our planning from those 6 to 8 weeks. And if we really want to implement a concerted push and really gear up and increase our outreach during that sweet time, those sweet spots of 6 to 8 weeks before an election, then we obviously need to do our planning work and our training work in advance. And so what we recommend is to think through building a civic engagement plan during the months of January through June, and then really begin to at least pilot voter registration and your second ask programs in the month of July or over the summer. And that way you have a little bit of time before the crunch time around an election to troubleshoot and to also assess what's working and what's not working. Lastly, this will also give you a little bit of additional time to do additional training with staff and volunteers or any kind of retraining after staff or volunteers have had a chance to really test out their skills and to do some of the work. So that again, leading into August and September and October, those last 6 to 8 weeks before an election, you are really ready to go with a concerted push.
Great. Thanks, Lindsay. So I'm not seeing any other questions right now, but I did want to just encourage everyone on the line to please note Lindsay's contact information. She's a great resource, and also wanted to encourage folks if you want, just any additional support if you're in the process of creating any of the various card tools that Lindsay reviewed, that we're more than happy here at AAPCHO and with Lindsay, Nonprofit Vote, to review those tools if you'd like for us to, and just want to extend that support. And then for those of you who are using tools, we'd love to also see what you are using. So if you get a chance to email those to me or Alan, that would be great. We're just trying to keep kind of an archive of all the great things that folks are creating. Lindsay, did you have any other comments? Because I'm not seeing any other questions right now.
No, I would just like to end by saying thank you to everybody who joined today's webinar, and just thank you to all of you for your ongoing work. We know this work can be challenging, and we also know that community health centers have a multitude of priorities and are providing so many critical services every day in your community. So again, just thank you for your general work, and thank you for your commitment to civic engagement work. I also want to give a special thanks to Alan and Jen for your work coordinating this program, and also for coordinating today's webinar.
Thanks so much, Lindsay. Yeah, we just really appreciate the opportunity to kind of step back and look at the list building and go through it step by step for everybody and get the tools out. So I should say too that you will receive an email after this webinar that contains a lot of the templates and the tools that Lindsay had shared. I also wanted to let you all know on the line that one of the next steps we're taking is to take the next step with Salsa, which is really just an organizing tool in which you'll be importing your lists as you develop them. I know people are at different stages of that process, but our next training, which will be on importing your list into Salsa and beginning to orient to Salsa as a database tool, is going to be on Thursday, August 20th at noon Pacific, so 9 a.m. Hawaiian time and 3 p.m. Eastern time. So just save the date for that, and Alan and I will send out a reminder about that as well. Also, just want to echo Lindsay's sentiments and thank you all for your time today on the training, and please feel free to contact us. We have an open line, open door policy to answer questions as they come up, and try to triage things as you all need. One note, as you close out of this webinar, you'll actually receive a pop-up survey, and we'd love for you to complete that survey. It just helps us kind of gauge the effectiveness of the webinar and things that we can do in the future. So with that, I'm just going to go ahead and close and say thank you again, Lindsay, and for everybody for joining us for today's webinar.
Great. Thank you all.